So there are two ways of getting PrEP in the UK. The first way is by going through the NHS, where you need to find a sexual health clinic close by that has spaces for you, will accommodate you, book you in, do the tests you need, and give you your medication. The other way of doing it is by going privately. Now, there are lots of online pharmacies that will provide PrEP, but they're not like us at ZAVA with the doctors on board that provide the service that we do. What we try to do is replicate a sexual health clinic that you might go and see on the NHS, but online, so you don't have to see anyone face to face. You can get all your testing done, you can get all the information you need to get, you'll get an assessment by real doctors who will make sure that it's right and safe for you to take PrEP, and then we'll send it out to you and follow you up as needed. So the good thing about accessing PrEP or any type of healthcare online is that it's accessible to anyone, really. You can go online, have a read through our web pages, make sure that PrEP is the right medication for you. You can see whether you've had all the tests that you've needed done, and then you go through an assessment where a doctor will look through the answers to your assessment and make sure that you're the right kind of person who should be taking PrEP. And they'll tell you how to take it, when to take it, and when to get retested. So here at ZAVA, we aspire to lead the way in online doctoring. What we've done is we've made sure that we are providing as safe and accessible a service as possible. So I work with an incredible team of doctors here, and what we've managed to do is have as much training on PrEP as possible. We've had a specialist come in and talk to us. We've had online training. We make sure that the tests that we provide you are the best on the market through our well-established partnership with the lab that we use. We follow all the guidelines that have come out about PrEP. We've made sure that we provide a service for you where you can chat to a doctor if you need to and ask any questions to your account. We'll get back to you as soon as possible. We want to make sure that this is as good a service as you'll find anywhere else. We'd always recommend you do whatever feels good for you. So if you think that getting PrEP on the trial is the right thing to do for you, then that's absolutely fine. But if you can't take time out of work, or if you don't want to go and see anyone face to face, then that's where we come in. You can go online through a company like ZAVA and be sure that you're going to be treated in the best possible way and get PrEP as safely and appropriately as possible. What we've done at ZAVA is make sure that anyone can go online onto our pages, have a look at the information about PrEP and decide for yourself whether you're eligible to take it or not. What we've recommended is that PrEP is really for those people who are at high risk of contracting HIV. Those people might include those who don't use condoms when they're having sex, especially with multiple partners. This might include groups like men who have sex with men, or sex workers who have sex with multiple partners and they don't know what their HIV status is. So if you don't use a condom and you're having sex with someone that you're unsure of in terms of their HIV status, you need to consider whether you should be taking PrEP. Once you've decided that you might be eligible, what you should then do is go through our assessment, which asks you a few questions to tell the doctors whether you might be right for PrEP or not. Our doctors will review it, and then if it's right for you, we'll send the medication out straight to your door.